Student nurse. For today's demonstration, I will demonstrate the wound irrigation, wound dressing.
So imagine now that we are here in the patient's room. But before you meet your patient in his room, you will need to perform the hand hygiene. And now, let us introduce ourselves to the patient. So good morning, ma'am. My name is Jenny, and I will be your nurse for today. But before we proceed, I would like to know some details about you. What is your name, ma'am? What about your age?
Identifying the patient using two identifiers. For the example is the name and the birthday of the patient, or the medical record according to agency policy. The rationale of this is to simply ensures correct for the patient.
Okay, how do you feel right now? Do you feel any pain? From the scale of 0 is as the lowest and 10 is the highest.
And then assessing the patient's level of pain. Why do we need to assess or ask the patient the level of his or her pain? The rationale of this is to provide baseline to measure patient's response to therapy. Discomfort is related to directly to wound or directly to muscle tension or immobility.
Okay. So now I will check your medical record for the irrigation procedure.
Checking the medical record of the patient is the rationale of this is the open wound irrigation requires medical record or order including the type of solution to use.
So Miss De La Cruz, do you feel any untoward signs and symptoms concerning your wounds?
In assessing the wound side of the patient, there is 8 and the number 1 is the size. Extent of impairment of the skin integrity including the size. The size should be in the following: the length, the width, and the depth. The rationale of this is assessing the size is to assess volume of irrigation solution and can be indicate changes in condition of the wound. And number 2, verifying number and types of drains present. The rationale of this is the awareness of drain placement facilities, safe dressing removal, and identifies type and quantity of new dressing needed. Expect the amount of to decrease as healing takes place. Drainage from wound, amount and color. Amount can be measured by part of dressing, saturated on items of quantity. For the example is the scan, moderate, and copies. The rationale is this is there is a different type of drainage. Here and D is the odor. Must assess whether or not there is an odor. If there isn't a strong odor, means infection process is present in the wound. You will not directly smell it into the wound. In others, you don't need to smell it directly to your nose. Wound tissue color. Color represents the balance between necrotic tissue and new scar tissue. Then F, consistency of drainage. Type of color of drainage depend on the moisture of wound and type of organism present in the wound. And G, culture reports. Chronic wounds heal by secondary intention and they are often colonized with bacteria. And then the last one is the condition of dressing, dry and clean. Evidence of bleeding, profuse drainage. The rationale of this is to provide initial assessment of the present wound drainage.
So after assessing your wound site, I would like to inform you that I am going to perform wound irrigation. But don't worry, it will make you feel better. Because wound irrigation is not invasive procedure in which a steady flow of solution is used to achieve wound hydration. Put the piece and cells, pathogen and excess blood or other exudates such as food and nutrition and assist with a better visual examination. Okay to you, ma'am. Okay, 30 minutes to 1 hour before we start, I would like to administer prescribe and analgesic. Good. It helps to control the pain level and should help you move easily. So now I will place you, ma'am, on a comfortable position during the irrigation. I have here a syringe, and then I will use the normal syringe for this demonstration. Like I said a while ago, that you can use a 3 ways. Use the water, normal saline, and then the hydrogen peroxide. So I'm going to take my syringe since it's improvised. Please understand. Just like what I said, they may be required for additional PPE for this demonstration. And also in the wound dress, you will need the gloves, mask, goggles, and a gown for us nurses to avoid the splashes of blood or the body fluids from the patient. So now I am going to take my syringe and the normal solution. The normal syringe. And now I am going to irrigate now. And then I will place it approximately 4 inches from the wound to prevent the syringe contamination. Let us gently depress in the plunger into our syringe and let the irrigation flows round down. That's the reason why you will need to position your patient in the right position. Also, it is going to pull inside the wound, nor you want to be dragging solution from the non-viable tissue to non-viable tissue. So we will going to continue until the solution runs clear. So the solution is no longer colored with blood or tissue. Now we proceed to dry the wound. So we will place it now to the trash. Now I will proceed to drying the wounds after irrigating the wound. So I will use tongue since it's improvised. You will need to use tweezer in actual. So in drying the wound, we're just gonna absorb extra fluid that's accumulated because you never want to leave the wound wet around because tissues can lacerate. And then discard it right away after you use. Do not reuse it because it can cause infection to the wound. And then also around the wound. Discard it right away. Okay. So now we are done with irrigating the wound. Now let us proceed to the wound dressing as the physicians ordered for us. But before you proceed to the wound dressing, make sure to document everything you do. And that's it for the wound dressing. Hi, it's me again. My name is Jenny and we're done with the wound irrigation. Now let us proceed to the wound dressing. Wound dressing should provide the most optimum condition for wound healing while protecting the wound from infection and microorganisms and further trauma. So in short, it can also as wound healing because it prevents issues and complications to the wound of the patient. In wound dressing, same with the process of wound irrigation, which is you will introduce yourself. But before that, we need to wash our hands before we enter to the patient's room. Before and after the procedure, you will use
we will wash our hands. So now, let us introduce ourselves again to the patient. So, good morning, ma'am. My name is Jenny. I am your nurse for today from the shift of 8 a.m. to 4 p.m. So, I am going to change your wound dressing. But before we proceed, I would like to know some details about you, ma'am. So, what is your name, ma'am? What about your age? So, now I will check your medical record. So, thank you, Ms. De La Cruz. So, upon checking your medical record, your wound is located at the side of your left, correct? Can you show me your right leg? Okay, so now can you tell me how much pain you feel right now? On the scale again from 0 from the lowest and 10 is the highest. Okay, let me see the chart again for the verification of and now, before we start changing the dressing of your wound, may I ask, do you have any allergies to any certain agents and tape? Okay, I see that you don't have any allergy. Okay, from assessing or asking the patient, she doesn't have any allergy. But if your patient have an allergy, you will use the hypoallergenic tape or bandages for him. Now, I will assess your knowledge. What are the ways you do whenever you're in pain? Okay, that's better. Within this week, did you notice any bleeding or discharge in your wound? Okay, you don't notice any bleeding or discharge. Now I will proceed to explaining the procedure for you. So I will perform the wound dressing in your wound. So now before that, I will explain to you what is the purpose of wound dressing. Wound dressing is to provide the most optimum condition for wound healing while protecting the wound from infection within organism. So in short, it would be better for you for the wound healing process, for the fast wound healing process, and to avoid infections. Is that okay to you, ma'am? Okay now. So I will place you, ma'am, for the comfortable position. And I will make sure to expose only the wound sign for your privacy. And I will change your dressing every 30 minutes, so following the administration of analgesic. I will remove the tape on your wound gently and tell me if you feel any pain. Is that okay, ma'am? Take note if the dressing sticks on a dry dressing, moisten it with the saline solution. So now I'm going to moisture the gauze using saline solution, and then I will remove the gauze carefully, slowly. Then take a deep breath, inhale and exhale. So removal of one layer at a time reduces the chances of accidental removal of underlying veins. Carefully, you can use the push-pull technique. It really releases tape from skin. Then you will discard it right away, including your gloves. You will change it. By removing the gauze or the oil dressing in the wound of the patient, you will discard it right away, and also your gloves. I'm using an antiseptic swab or septic solution. I will clean your wound. This is to prevent contamination and spread of infection at your wound site. It should be bottom to the top, B, top to bottom.
And do not reuse the gauze because it can cause more infection to the patient or in the wound site. So now, after that, you will remove the gloves again and do the hand hygiene. Upon opening the package of the glass, and then you will hold it at the two diagonal opposite corners, centering the gauze over the wound, and then securing it in the place by using the wound and securing it by using the adhesive tape. Apply it at the bottom of the gauze. Oh, you will apply it in top, and then you will apply another for the bottom, and then for the last one is in the middle of the gauze to secure. Done. Now let me evaluate it. And now, can you tell me now how much pain do you feel right now from the scale of 0 as the lowest and then 10 is the highest? Okay, I see. Okay, I see. Now I will take note and document including the current condition. Besides, I will come here to visit and recheck your wound every 3 to 4 hours to check on you and your food. Thank you, Ms. De La Cruz, and see you later. And that's it for the wound irrigation and the wound dressing. And lastly, you will need to wash your hands before and after the demonstration or in the action. See you. Bye-bye.